Welcome back to another episode here on the Heart and Hustle podcast. She changed major 6 times, walked away from a stable system, and built a practice where patients cry out of relief, not frustration. What are the moments, Erin? What was that moment you realized nursing wasn't just a job, but it was your actual purpose?
hmm Yeah, yeah. I mean, I think you hit the nail on the head. It just really, when you hear patients just kind of gush about how nice this system is compared to the frustrations of the insurance-based system, there's a lot of reward in that pretty much daily. But yeah, the moment where I really realized that this was more than just a job and more of a passion was in my first job in primary care. And you just get a relationship with the patient and you really get to know them, and you're really a part of their life, and there's a trust there, and that was really what kind of led me into this whole career to start with.
You now 6 majors. That's a lot, right? Some people don't even go and get one. What were you searching for that nothing else gave you except nursing?
I know. Well, I think I realized at some point along the way that I was a people person. And so, a lot of those were in math and accounting and some of these things that were necessarily not chatting with people every single day. And so at some point along the way, I realized that I really did. And a lot of them were in science, and I did not want to do research. And so a lot of that was me kind of trying to take my passion of science and math and that side of my brain and be able to somehow connect that into a way that I could really get, those interpersonal relationships and those interactions with people every day. And so it just took trying a couple different things before, in my case, six different things before I ended up here.
At least you didn't give up, right? You
No,
said, "Hey, I didn't find it here. Let me go somewhere else." And
that's right.
and that's good because you never got comfortable in something, right? You
Right.
already knew, like, wait a minute, I this is not
Mhm.
it for me, and you moved on to the next. And I could only imagine it was probably a challenge at time mentally to pivot
Uh-huh.
at times,
Yes.
because you're like, wait, am I doing it again? But you did. It all worked out, and here you are. And what's even cool is before you started your own practice, you were actually in a respected hospital.
Mhm.
What felt wrong about that world? Because
Mhm.
really, you went out, you found what was wrong, and now you're implementing all the rights to those wrongs in your own practice. What went wrong working for that respected hospital?
Yeah, so when I was a nurse at Duke Hospital, and it was hard because the institution is fantastic. I mean, if you're sick and you need to go to a hospital, that's where you want to
Mhm.
be, right? But what I realized is that there's a lot of the hospital work that was really just sort of reactive. By the time I saw patients in the hospital, they were really sick. So they had had these kind of diseases for a long time period that had led them there. And I really wanted to be able to have that relationship with them before the disease had progressed to that point, and to try to, there's a lot of stuff that I realized we could prevent in that situation if these patients had just gotten a little bit more intensive of eyes and a workup prior to the hospitalization. There was a lot that could
Mhm.
have been prevented if there was a bigger focus on preventative help. And so that's really what kind of drew me out of the hospital world and into the primary care world.
And doing an amazing job now, giving them 60 minutes, right, when they're not even getting 6 minutes.
Hmm.
Sad as it seems, or not seems, but that's reality. That's
Right,
just what we live.
right.
How does it make you feel now emotionally, knowing like I was in a space where 6 minutes is probably all they've seen eye contact, but now I'm fully, I mean, you even remember the kids' names,
Right,
you know?
right,
Why does that matter? Why does
right.
that matter in medicine? And how are you feeling emotionally now that you're in this space of
Hmm.
making a difference?
Hmm. Yeah, yeah. And I think, when you're in that traditional insurance type model, you're right. You're going to get 6 minutes with your provider, and they're distracted and rushed. And it's,
Mhm.
we have some really great providers in this area and really intelligent, passionate people, but then they're stuck in this system where the insurance company is kind of dictating how long they get to spend with patients. And so it's more about how many patients they see in a day and how quickly they can move through them and how many little boxes they can check and all of this stuff every time that
Mm.
in the room with your provider. And anyone who's been to a provider's office has experienced that feeling, right? Of being rushed and of
Yeah.
not feeling like you had time to really discuss everything about your health and get all your questions answered and all of that. And so that's why when I opened this practice and kind of wanted to expand that time period that I get to spend with patients, you're right, I have a 60-minute. Most of my appointments are at least 60 minutes. Some of my new patient ones are even an hour and a half. And so that's important because then you do get to know their family dynamics. You get to know what's stressing them out at home, what brings them joy at home, and you get to know kind of them as a whole person. And it really does make a difference in how you treat somebody, to get to know them. And everybody is different, and everybody's care plan should be unique and individualized. But you're not able to do that unless you actually ask them their preferences for certain medications, or if you prescribe a medication that you have to take twice a day, are they going to remember that? And it's one of those things that only they know that, but you do have to dig in, and you have to kind of ask those questions and figure out what's going to be best for them. Is that going to be something that they're even going to be able to do? And that's where having that long time and, you know, really that space to be able to do that and dive into the person as a whole really makes a huge difference in preventative care.
I don't know why this came to mind because this is completely off healthcare, but it brought me back to a time when I was in a restaurant and the service, and really because you mentioned the service and how someone feels,
Hmm.
that's truly what makes them come back, right?
Yeah.
When you remember their order, in your case, when you remember what you spoke about them to them last time, when
Yeah.
you remember their name, when you remember who their kids are, and you just show that you care, right? Sometimes it's just that, just show that you care. A little empathy goes a long way.
Yes.
So you're really in a neat space where people come in a little happier, probably to see you, right? A lot more
Yes. Yes.
smiles. It
Yes.
feels like a great friend that you're just catching up with.
Yes.
Um,
Yes.
but I can
Exactly.
imagine doing this, taking this leap of faith that's been going well for you. There's
Hmm.
probably times that you're waking up at 3 a.m. as a solo founder, like, what am I doing, right? Are you? Is those moments happening?
Yeah. Oh, yeah. I don't think you can start a business and not have that. Like,
True,
is this going
true.
well? Especially because this model is so unique. Direct primary care was originally started in 2010. So, I am not by any means the original founder of this idea of doing things or this model. And it is all membership based. So all of my patients pay, it's about $80 a month from, it's an age range, but most patients, most ages are $80 a month, and they can come in as many times as they want, unlimited visits, unlimited texting, unlimited phone calls. We can really, really get to know somebody. Um, and because of that, because of it being, a relatively new model, there are not a ton of practices like that in the country, and particularly in my town of Durham. There's really not a lot of us in this area.
Mhm.
So yes, there was a lot of, me just poring over spreadsheets when I started. Like, is this financially okay? Like, am I gonna have to close the doors in a year? Like, can I actually make enough money to sustain, my
Yeah.
feeding my kids and still be able to keep rent paid and that kind of thing. So I think there was a lot of stress and a lot of uncertainty at the beginning, but we're getting in the groove of things now, and it's going really well.
That's good. No, I 100% agree. There's a sacrifice there. And when you're putting the weight of your family, it's not like it's just you, right? It becomes easier if it's just you.
Hmm.
But I hear you. When it becomes the family and you make this jump when you didn't have to, per se, right?
Hmm.
Money was
Right.
probably good,
Right. Right.
but you wanted to do something different, make more impact. And I'm happy that it has worked out. I really want to talk about, though, because a lot of people fear doing things alone, right?
Yeah.
What made you say, I'll figure it out anyway?
Yeah. Yeah. That's because I was terrified of that, and I really wanted a partner. And so I tried to convince, when I first started this, I tried to convince another coworker of mine that was another nurse practitioner, and I tried to convince her to come into this with me. And I was like, we can do this together. Like, there'd be two of us. We'd be sharing a lot of the financial risk, a lot
Yeah.
of just there is when you do have this kind of membership model and you're the only practitioner at the primary care office, you don't get time off, and so when I go out of town, my cell phone, of course, goes. Thankfully, we have a very, very, digital age, so I can take a cell phone with me. I can do virtual visit from the beach. We can kind of stay
Hmm.
connected and stay there for, patients who do need me. And so there was a lot of that where I tried to bring in a partner from the beginning, and yeah, it ended up just did not work out with her. She could not be convinced. So here I am doing it on my own. Which it's turned out to be really good. A lot of my patients are really respectful of when I do take time off to be with, with my family, and they don't bother me at night unless it's, really an emergency. And so, they've been a respectful, really, really respectful group of people. I think there's a lot of fear in the normal environment with providers because it's really hard to call a doctor's office and talk to your doctor. And so in
Hmm.
this model, they know that when they text me, they're texting me directly. And so I will get back in touch with them and I will answer their questions, and they'll have time to make sure that they get handled everything that they want to get handled. And so it does sort of decrease that anxiety on the patient side of things because they know Aaron will text me back.
And that's good. I experienced when my wife was pregnant and having to go and see all these doctors, and you know how that is. It's like
Mhm.
nonstop
Uh-huh.
doctor's
Yep.
visits, and yeah, she would have to call, and it wouldn't be the doctor per se. It would be the assistant to the
Mhm.
doctor, the receptionist, or somebody giving the information, transferring information,
Mhm.
and what happens is at some point it could probably be missed information as well,
Mhm.
right? Like you
Mhm.
got so much going on at the
Mhm.
assistant level that
Yep.
one doctor told you this and this
Yep.
person told you this, you might just
Exactly.
be giving the wrong information. But
Exactly.
talking one on one, it is always the correct information.
Right.
You've worked with that
Right.
patient, you've seen that patient, you prescribe that, like you get it.
Right.
So I can imagine it's probably. Do you find it easier now?
Yes. Yeah.
Much easier.
It's much easier to do medicine. Yeah. Yeah. And a lot can be handled virtually. And it's
Yeah.
just shocking to me how much can be handled over text.
Yeah.
So they text me, they've started a new medication, they're texting me about side effects. Well, we can tweak doses and all of that based on kind of what they're telling me. Or, I have patients, if their blood pressure is high, I have them do home blood pressure checks and text me those numbers. So they'll send me pictures of their blood pressures, and so that way when we can catch things earlier, like, hey, this is not as controlled as I want it. We need to increase your
Mhm.
medications, or, ooh, this looks great. I think we're on the right track. You can really, in real time, be able to kind of take care of people.
And are you still a one man show or one woman show in this
Well,
case?
yeah,
Yeah. Oh
yeah. So I'm the
man,
only
and it's
provider.
I'm loving.
I did end up I hired an assistant, and that was a lifesaver. So I do have, she's
Oh,
part-time,
good,
about
good.
20 hours a week. And so I do have an assistant that has taken there's a lot of, between getting insurance, even though I don't take insurance, we still have patients with insurance. And so, if we order an MRI or something, we still have to get prior
Mm,
authorization from insurance
yeah.
for stuff like that. So there is still a lot of administrative type paperwork in that regard, and scheduling and invoicing and all of that kind of stuff has been really helpful to have somebody help me do.
That's good. How many years in total have you been on your own now?
I just celebrated my year birthday, so it is brand new. Yes.
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 Congratulations. I say that because now you're an assist. Now you got this assistant, and I think the last
Mhm.
time I spoke to you, I think maybe you were
Yeah,
just still
might
in a
not have.
solo
Yeah.
run.
Hmm.
Yeah,
Yep.
yeah. And I just hired an assistant, and I was just literally just telling my wife, like, man, it feels so much better that all this just small little work, not that
Hmm.
I can't do it, but
Right.
it takes away from so much, whether it's
Right.
family time, whether
Right.
it's patient time,
Right. Exactly.
client time, whatever that may look like. And I'm only doing 15 hours right now, but it's a difference. So I'm like,
Mhm.
my goal is to make it a full-time thing, right? We got to make more money though.
Yes.
So I'm
Yes.
happy you're experiencing that too, and feel the kind of that weight off your shoulders just
Hmm.
a little bit.
Yes.
That's
Yes.
exciting.
No, it makes a huge difference.
When it comes to you're growing,
Mhm.
but quite in that gently space. What's the line you refuse to cross in the name of actually scaling?
Yeah, so I mean, I think a lot of this is sort of what I'm figuring out right now and a big question in sort of these direct primary care practices is what's your panel size and how many patients can you take?
Mm,
Because, you know, in a primary care at, a major one of these like hospital institution type primary cares, they'll have, oh, sorry, they'll have, at least like, sorry about that. They'll have at least like 4,000 people on their panel. And in a direct primary care, we can't do that, right? Because the whole point is to be personalized and know these people and have that time. And if ever anybody's sick, I want to be able to get them in same day or next day. And so, a normal direct primary care practice will only have about like anywhere from 2 to 400, 500 patients on a panel. So somewhere kind of in that
Wow.
range. So yeah, and I'm getting close to the 200 mark. So then kind of trying to figure out, yeah, where
Yeah.
that looks as far as, the future of, do I hire another provider?
Yeah.
Where does that go? Because I do want to be able to provide this level of service to people, and it seems to be a needed thing in this area and a desired thing. And so to be
For
able to
sure.
continue to be able to provide that probably does mean that at some point, in the next year, hiring somebody.
If the Heart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure to guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. So have you actually also? I know you said you're looking at to that scale.
Mhm.
5 years from now, is there something that you would love to do 5 years from now, and what must stay the same no matter what?
Yeah, I mean, I think my availability to patients and because I'm not overwhelmed by numbers and I'm not stressed out, and these patients do have an hour of my undivided time for their appointments, I am able to really focus and really listen and really, I mean, they're getting a non burned out, fully
Mm.
focused me. And so that is one thing that I will maintain forever. So that's really has to be maintained. And so if that means that I need to hire another provider, cap my list and then hire someone else to take on anyone past that, then we'll do that, because that's the benefit of owning business, is that I can determine
Yeah.
when we've reached that point and when we hire.
When you mentioned burnout, have you had that moment where you felt burnt out? And what does burnout look like in a space where you're speaking to patients? Is it just the workload? Is it just the things that you hear? Like, where does burnout even come from?
Mhm.
Especially where you say, "No, I'm happy." I don't even know if it's happening, but just want to kind of for
Yeah.
those that may want to do the same thing.
Yeah. Well, the beauty of this is that it's not happening in this job. And that is 100% why I left the last place I
Hmm.
was working. Because in that place, it was happening. And so that's where, it would just be patient after patient after patient after patient, and trying to see, certain numbers at the end of the day, and not feeling like I was pulled in 17 different directions, and not feeling like anybody was getting like the best of me. And so, to me, that's a time when mistakes are made and when things are missed, and when I'm not, that patient deserves your full attention when they come in. And if you're busy and rushed and thinking about 17 other things, they're not getting that. And so that's what I'm loving about this, is that I haven't felt burned out once. And so the
That's so
beauty of
good.
this is that, because I am getting more time with each person, and we don't necessarily need an hour for each visit, but at least they know they have that, and I know that we have that. So there's no rush, right? We're able to kind of talk. If they want to talk for 5 minutes, great. If they want to talk for 15 about one thing, fine. We have that. And so we can kind of really take our time, and I think that's what you don't get in a normal
Hmm.
kind of primary care setting, is time.
Yeah. When I have my coaching, I do coaching and consulting. So with the clients, like you mentioned, maybe they don't need the full hour, but knowing that they have that time slot that is
Mhm.
completely theirs, acts away, like, take your time, no need to rush, truly does make a difference. For us, the ones that are providing the service,
Mhm.
but also the ones that are receiving that service, it just makes things a little bit easier. As you mentioned, the anxiety becomes a little less because
Mhm.
they know they're not going to be rushed out of a room
Yeah.
without having all their questions, right?
Mhm.
Sometimes you that causes us to not think correctly,
Mhm.
right?
Right.
So
Right.
you're in a better place
Right.
now, right? Just
Right.
relax. You go in
Yes.
there, you create your own
Love that. Mhm.
schedule.
Yeah.
I love that. I love that for you, and I love that you're growing and you're not feeling the burnout, and that
Right.
you've now added, not feeling a burnout, and then you still added someone that's just like
Mm-hmm.
you're living the dream at this point,
Mm-hmm.
right?
Mm-hmm.
It is a
Yes. Yeah.
so I almost feel bad for the coworker that didn't jump on
I
board.
know. I
Did
know.
you still do you still have that conversation?
Oh yeah, all the time. I know. I know.
Yeah.
Yes, all the
Oh my
time.
gosh.
All the time I see her. Yeah. Maybe
What is she
she'll
saying to
still
you?
well, maybe she'll still join me. I told her that I was gonna go make some money and be able to pay her. And then
All right,
yeah,
there we
yeah. I
go.
think, it was a little hard to bite off that I'm gonna come work with you, but I'm gonna make $0 for a little while.
Yeah, yeah.
When you
That's
start
that's
a
what
business,
happens.
it's a rough, for a working mother with kids to feed. That's a rough
Yeah.
pill to swallow. And so,
It is, and it's just not for everybody.
no,
It's just not for everybody,
no,
and some people would love to work for that private,
mhm,
doctor or practice, and people love those privates, but they will never do it themselves, just
right,
because it is
right,
very, very hard.
right,
It is you have to be strong-minded. You have
right.
to, I mean, have faith that
Mhm,
it's all going to work out
mhm,
through those dark times. I can imagine that you probably faced some of those times where you had imposter syndrome. What the hell am I doing? Am I
mhm,
doing the right thing?
mhm.
But you pushed through, so congratulations. What does it mean to lead with heart when the whole system is actually built to break it?
I know. Well, and I think that's really where you don't have time to do that in another kind of setting, because in a traditional setting, you're leading by what the the insurance company says we're doing. You're leading by, hey, this person comes in with high blood pressure. Well, we need to do X, 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 and X. And on this side, it's like, okay, but let's look at that as a person and figure out why their blood pressure is high. Are there things we can do to reduce that before we just throw medication at it? Because throwing medication at it is the easy. That's only going to take you 5 minutes at that
Yeah.
appointment, right? But asking about, are they stressed? Are they exercising? Are they sleeping well? Do they have sleep
Mhm.
apnea that's not been diagnosed? Like where are some of these other areas that we could, with more time, invest in, and even just small tweaks to whatever it is that their lifestyle is. Can we fix something else or work on something else? I mean, yeah, sure, sometimes we just need meds for things. Blood pressure, sometimes the only way to bring that down is with meds, fine.
Mhm.
But to really make sure that we've maximized all of that other stuff, and to put like heart into that, takes that time. And so I
Mhm.
think that's really where it's just a very different way of kind of looking at healthcare and the human body.
And how about for those who've lost trust in the system? Pretty sure you hear that all the time.
Mhm.
What's the first step back to hope?
Hmm. Yeah, yeah, that's a very, very good question. And I do get that a lot. I have a lot of patients that have had medical trauma. And so those seem to be patients that do find this model a perfect fit. And I mean, that is really on the extreme scale of losing trust in the system. I think most people that you talk to out, in the world right now have lost a little trust in primary care, and then they've just had bad experience after bad experience after bad experience at their provider. But there are a lot of people who have actually had medical trauma. And so every time they walk into a provider's office, and they tell me, like, even just the smell of the cleaning supplies and the hand sanitizer, those smells
Hmm.
and those environments really bring them back to that trauma. And it's hard for them to to even accept care and get care.
Wow.
And, they end up not going for
Mhm.
years and not having any kind of care. And another thing that people have lost trust in is the cost of things. And I think that's a huge one. Is there's so many people, myself included, who have these stories of we go for an XYZ complaint or concern, and we get this surprise bill afterwards, and we're
Big surprise, Bill.
huge. Oh, huge. I have good insurance and I get huge surprise bills, huge. And it's just shocking. And so I think that, that's just not what this is based on. This is based on cost transparency. So people without insurance who have just been burned time and again at providers' offices with these huge bills come in here, and I have a list of all the labs and what it's going to cost you. and they're cheap. I mean, most of them are anywhere from like $2 to $5 for a lab test.
Wow.
Like they're very, very cheap. And then they know that they won't owe, after they've paid their $80 per month, they never owe a copay. They never owe anything else for my time. We can do a strep test, a EKG, whatever else. We're not going to charge them extra for those. Like everything is
Wow.
just so either included or very cheap and cost, we know what it's going to cost. And that's kind
This
of part of
this
this
is really
job
good.
is for me to be able to tell them what it's going to cost. Like I'm not doing anything to you where, oh no, that's just an estimate or there's no estimates. Like this is what it costs, which is,
This story just came to mind just because transparency, the rush and everything. It's actually a pretty funny story. So, I decided I was speaking to a neighbor. He was going through his own medical conditions. I think he was having cancer. He ended up passing away. But when he told me that, being a father, I was like, man, I need to make sure that I go get my yearly checkup. So I went to the same place that my wife goes to. So she's like, yeah, go here, X, Y, Z. I'm, okay, good. I go in there and I'm talking to the doctor, and it's almost what you say, they didn't know who my wife was. They didn't know who the hell I was, right? So I'm talking to her, and she's like, when I say, "Hey, you took care of my wife, Desiree," she's like, "Oh yeah, yeah, yeah," but the whole time she's lying. So when I told my wife who took care of me, she's like, "Oh, that's not my doctor." So I'm like, "Wow." So she acted like she knew who you were. She's like, "I've never seen that lady a day in my life." I'm like, "Man, right? How embarrassing is that? Like, do I want to go back to that person that just lied to me and act like she knew who the hell I was?"
nope, nope. It's not personalized at all. It's so impersonal.
Yeah.
You are a number in those
Yeah.
systems, and it's sad, but it's so
But this
true.
model lives, right? This is not just like you mentioned. I didn't create this model. Is this? Do you know if this is kind of in every state?
Yeah.
Um, it is.
Yeah, so there is, if you are looking for a model like this, you can just go and Google DPC for direct primary care
Hmm.
mapper, and they have a map where they have all of these models. And I mean, I'm pretty sure there's at least one in every state. There's a handful in every state,
Love
probably.
it. I love it. I think it's good. I think it's right educating the people to understand that there's better places than going to your normal traditional
Mhm.
doctors, because there is that fear of misdiagnose, you know, surprise bills, and like we mentioned, it's not little bills. These are big $1,000 bills. So when you're sick, you automatically think, well, I don't want to go to the doctor and get this crazy bill. I'm just going to try to figure it out at home, not realizing sometimes it could be a little deeper than what we actually think. But
Yep.
because of the fear, the trauma, all these different things,
Yes.
you are
Yes.
correct.
Yes.
People are living in a
Well,
different place for sure.
even for myself, I had labs. I had my assistant draw my
Mhm.
labs for my primary care visit that's coming up. I said, well, I'm going to do my labs in advance because I know I
Mhm.
can get, the cheaper price on
Yeah.
them, right? So she gave me the list of everything she wanted me to do. Fine. So we drew the labs, we drew them off. My assistant had just put it in wrong as I was going to do cash pay with LabCorp. Like she had not put in that we were going to bill it from here. I got a
Oh, okay.
bill for $1,000 for my labs. And so we called him up. We said, "Oh no, like the practice is going to pay for my labs." And we got the bill ended up being $44. So I mean, that's dramatic. And it was like normal labs. It was like vitamin D and stuff like it was not even
Wow.
anything crazy that I was having tested. And yeah, the cash pay price from LabCorp was going to be $1,000. And I was like, oh, thankfully I got that bill and knew it was wrong and I could fix
Yeah.
it. But that's the fear that, people are really actually living. They go
Yep.
to a
Yep.
normal primary care visit and their lab bill could be $1,000.
Yep. And like you mentioned, the education. But that's why I love having this conversation because you're really educating us on this. There's a lot of education. Sometimes we could have those conversations, but when you call and then you get transferred and you get this, like that's also part of the experience. Like
Yep.
all of it is part of the experience, from when you call the doctor to when you go see the doctor to when you leave the doctor. And all that accumulates on a bad experience.
Mhm.
For yourself, it's like when you go in there, it's almost like I go to the barber shop, right? You get that sit in the seat, you have the conversation, you just almost enjoy yourself knowing that you're in good hands, and you're going to get consistent quality. And never be rushed out of this seat or this office. So I love it. I love that you found your space after 6 majors that you found. And look at that. It was like almost meant for you to be here, right? Now you have your own practice. Who would have
I
known?
know.
Who would have freaking
I know.
known? So before we get to the blind question, which we're about to get into in just a bit, where can people connect with you? Are you on LinkedIn? Is there a specific website people can visit? Go
Yeah.
ahead and shout it out.
So my website is Compass Health. dpc.com. And then I have an Instagram page and a Facebook page. So you can follow me on both of those. And I do try to post some about, you know, tips and tricks about sort of how to navigate the healthcare system because I do think that that education piece is helpful. But those are kind of the main two places to find me. And you can just search Compass Health DPC on Facebook or Instagram and find me there.
Love it. I love that you're also on social media, still
Mhm.
educating. That's
Yeah.
how you know you got time. Look at all the time you got, Erin.
Right? Right?
I appreciate it. So this blind question comes from our last leader on the Heart and Hustle. What's one truth about leadership or healing that still rock solid today that was just as true when you first started out?
hmm Um, I think that the thing that oh gosh, I think that the thing that is most true about this kind of leadership role when I started and when I am now is kind of finding the support systems that are helpful to me. So like my assistant is amazing and she started out as my nanny and has now she wants to go to med school, so that's sort of how we've transitioned her into this role here. And so just finding those good people that you can really lean on and knowing who you can trust and who you can get support from is so key because it's not just me standing up here by myself. You know, my husband
Mhm.
has picked up the kids from school more times than I can count. You know, I text him, hey, you know, somebody wants to be seen today at pickup time. Can you get the kids instead? And, you know, financially, the support that I get from him and the childcare stuff at home. I'm working a little bit later tonight to see patients and he's cooking dinner. You know, just really having those people,
Mhm.
um, those people in your life and realizing that even though you can be a leader, you're not alone and you really can't do it alone. And so finding good people in your life and leaning on them, I think is just so huge and so valuable. I think that.
Shout out to a good dad and a good husband, right, for
Right.
allowing
He's
you
great.
to
He's
live the
great. I mean,
dream per se.
he's great. I can't do this without the two of them helping me. And so, you know,
Yeah.
I think just kind of appreciating that and being appreciative of those people in your life is important.
I love it. I love it. What is your blind question to the next leader that we have here on the Heart Hustle?
Yeah. So my question was going to be that what was the challenge? What has been the challenge that surprised you most? Because I mean, we
Mm.
know when you go into entrepreneurship, you know that there's going to be challenges, and you pretty much like mentally expect some of them and mentally prepare for some. So I just, you know, I think it's interesting to hear what people think is the one that was the most surprising. Oh, I didn't realize that was going to be hard, you know, and so I think that's a
I
fun.
like that. I like that because there is, like you mentioned, there's a lot of success and a lot of challenges.
Mhm.
Sometimes the challenges outweigh the success, but that's why you got to keep pushing. You got to keep pushing.
Right.
Erin, thank you so much for your time. Truly has been a blast just getting to know more about this independent space, right? I'm gonna have to look into it. Didn't know it was a thing, but today I was a lot more educated. Thank you for sharing that website with us as well. For those that are watching, do not live in fear. There's places that truly care, that are not just asking for the big paycheck, but truly just wanting to help you live a better life, right? Stress free, anxiety free, just giving you the undivided attention that we have not really witnessed in probably so many years. But thank you, Aaron. If you guys are enjoying this, make sure you guys do like, subscribe. Make sure you guys do also just tell somebody they don't have to live in fear anymore. This has been the Hard Hustle Podcast. We'll catch you guys on the next one. Laters.